So I just want to start off just this week by quickly framing and reminding us that COVID-19, of course, has unequal impacts in our society. And I think that's a big part of what I want us to make sure we continue to be mindful of going forward. Now, this was a slide put out by the Ontario Science Table last month, really showing the impact on people who live in long-term care homes versus elderly people who live outside in the community, and just the disproportionate impact the pandemic has had on terms of people living in long-term care home on how likely they were to die from this virus, especially in the first couple waves and then in the most recent wave from the Omicron variant. And we know, of course, people who are 80 and up are at greater risk of dying than people who are at younger ages. We also similarly see this when we look across socioeconomic strata. So if we're taking the people in quintile 1 who are the lowest income up to the quintile 5 who are the highest income, we can see that throughout every wave, the people who have the highest income are much less likely to be passing away from COVID-19 than the people of lower income. And part of, I think, why we always want to be trying to do our best to control this virus is that it has these unequal impacts on our society. And we really want to try and make sure that our society is a place that is going to be serving everybody, not necessarily just a few who are well off or who are younger or who are at lower risk. With that, let's take a look at where things are going with the pandemic. And I think there are some signs of cautious optimism for us. So this is the province-wide wastewater data where we've kind of plateaued for a while and we're up for a bit. And we can see that we've just started now actually to finally see a downwards trend in that wastewater signal. So we might be starting to head towards the infections coming down a little bit. And that's hopefully going to be helped by our finally arriving better weather. We look here at the regional breakdown on wastewater. We can see in our area, Niagara, Central West, we're not seeing as sharp of a downturn as maybe some other areas are, but at least we're starting to trend in the right direction. And if we take a look at our wastewater treatment plants and what they're seeing, we do see there is a little bit of variation here. So if we look at Grimsby, there's a pretty clear signal here that the virus being detected in wastewater is coming down. Similarly here, if we look at the Fort Erie wastewater treatment plant, the signal of virus pretty clearly is starting to come down. When we look at something like Niagara Falls, though, it's less clear. Maybe in the last few days, we've seen a drop from where we were before, but we weren't necessarily seeing that reduction until then. We look at the Crystal Beach wastewater treatment plant. Again, maybe the last couple measurements here are showing a bit of sign of decrease, but it wasn't really as clear as it was for Grimsby and Fort Erie. And then when it comes to the Port Weller wastewater treatment plant in northern St. Catharines, hard to say necessarily that there's been really much of a decrease at all. These readings are higher than some of the ones we saw last week, maybe a little lower than what we're seeing a bit earlier. Likewise, if we're looking at the Welland wastewater treatment plant, again, it's not as clear there's necessarily been a reduction there. And so, I think there's some hopeful signs that things are improving, but it might not necessarily be as uniform across the region as we'd like. At least though we're not seeing any further increases. And I do think that these wastewater data that are showing some positive signs are probably correct, because when we start to look at some of our other data, I think we do see a consistent trend. So these are COVID cases in Ontario wide, and we can see there's been a dip over the last week or so. Likewise, when we're looking at the PCR confirmed cases in Niagara as well, we can see that we actually have started to come down a little bit. Obviously still quite high, but compared to where we were in past summers, but we're at least trending in the right direction. Percent positivity provincially is continuing to show a bit of a downwards trend, which is good. And then here in Niagara, we've actually finally seen a reasonably valid drop in our percent positivity, coming down from being close to 20%, now close to 15%. So again, that's pretty consistent. That being said, we're only starting to see these benefits in the hospitals. The provincial hospital signal is actually quite good. There's been a dip there in the overall hospital numbers there. Not so much in the ICU numbers, but fortunately the ICU numbers never really went up. That kind of peaking around early May is consistent with what the Ontario Science Table is showing when they show these various trends, and probably a peak that would occur first part of May. So we, I think, are fortunately seeing that, and their modeling has been correct in that element. When we look at the hospitalizations here in Niagara, it's maybe not quite so positive. So this is what Niagara Health has been seeing, and we're not really seeing that downwards trend here. And in fact, if you look at where we are here, we're still, higher than this was the third wave. And actually, that is, I think, only one person hospitalized fewer than where we were at the peak of the second wave. So still a lot of work that Niagara Health is dealing with in terms of COVID patients who are hospitalized. The ICU numbers are a lot better, where we're not really seeing much change in that. So that's at least a positive note. And small bit of good news here, as we break down the hospital numbers, the people who are being treated primarily for COVID-19 is maybe a bit flatter. It's people with a secondary diagnosis of COVID-19, or COVID-19 is maybe a contributing element to their illness. Those are the ones who are really driving our hospital numbers up right now. That being said, it's not clear that this has necessarily dropped by much yet. So there's still a lot of stress there. And of course, all of these patients need to be hospitalized. The hospital needs to wear enhanced PPE. It is still a lot of work, even if they might not be treated primarily for COVID-19. They still need to be cared for in a special way. And we can see the hospitals, in Niagara, this is Niagara Health plus West Lincoln, remain well above their capacity and have been, really, above capacity since really fall of last year. New people being hospitalized, is trending down a little bit here in Niagara. So, I think that does fit with what we've seen, where the people being treated primarily for COVID-19 has been going down. Still, of course, much higher than we were in past summers, which I think is the goal we want to get to eventually. The positive trend we're seeing is also, I think, reflected a little bit in our outbreaks, where we've seen a small number fewer of outbreaks of late. Not back down to where we were even, maybe 6 weeks ago, but, we are definitely starting to show the trend that we want to see. The trend is not so good, though, when we look at people dying from COVID-19, where we can see the number of deaths in Ontario is trending upwards right now still. And here in Niagara, we can see that, going a period of time where we're having only at most one death a day, and even this stretch where we didn't have anybody, we've started to see those deaths become more frequent. Those lines are closer together. And we're starting to see more numbers that are above one. So multiple people being classified as having died on any particular day. So, I think overall there is a positive trend we're seeing, that probably we've peaked in our number of infections and they're starting to come down. Provincially, the hospitalizations are coming down, but not so much here in Niagara. Those will hopefully follow eventually. But still, there's lots of people dying from COVID-19. And so we do need to be, mindful that it is a bit of a mixed picture still, where while things are improving, they're not completely better yet. And some people are still suffering that worst of all consequences from COVID-19, which is, of course, passing away. The other thing I want to talk about, of course, is the other big consequence for people who may be hospitalized, who fortunately don't die of COVID-19 and who recover, is that they may go on to suffer from long COVID. And the Ontario Science Table is highlighted that, conservative estimates suggest that 10% of unvaccinated people who get infected with COVID-19 will end up with these long-term persistent symptoms of illness, which is long COVID. It's probably some percent of vaccinated people as well, but fortunately much less than the 10%. And we're seeing more and more science coming out highlighting this. There's another recent study that came out based in Europe, where they looked at 120,000 plus patients who'd had COVID-19 and classified all of the different kinds of side effects that they seem to be suffering from months on. And so they have, effects on their chest, on their lungs, their brain and psychological health, more superficial stuff like skin loss, all kinds of gastrointestinal illnesses, a whole bunch of different kinds of brain impacts here: seizures, dizziness, headaches, memory deficits, cognitive impairment and brain fog we've heard about, difficulty smelling, difficulty concentrating. So real impacts on some people who go on to recover from COVID-19, but there is still a cost to people, even if they do get COVID-19 and recover. And this was also put out recently and actually mentioned by the Ontario Science Table, which is how some people who have COVID-19 go on to actually have these cardiovascular diseases longer term. So within the first year after having COVID infection, your risk of having some of these is increased. And then some of them, we're talking about increased by up to a rate of about 10%. So, if you're looking at something like, um, myocardial infarction, which is basically a heart attack, you add all of these up, you're coming up to maybe close to about 100 out of every 1,000 people is going to have increased risk of that. And so, there's significant risk to do this. And we do want to make sure we're trying to control COVID-19 longer term to make sure we minimize people suffering from this. As has been noted by others, surviving the pandemic is only half the battle. We're going to have to survive this long COVID wave that is going to affect us after people get through the pandemic. And I just want to highlight as well, we've been hearing a lot about this mystery hepatitis illness that has been affecting children, especially in Europe, but we've had some here in Canada. And last year, when India had a really huge wave of COVID-19 in their country, they noticed a bunch of children who had hepatitis as well, associated with that COVID-19 infection they've had. And I don't think we can say that this is proven yet, but there's this very suggestive that perhaps those hepatitis cases we're seeing right now that we can't explain the cause of, it is actually another manifestation of long COVID and the way long COVID is presenting in children. Don't want to say that that's for sure, but this is now one of the leading theories of what might be happening. And I think it's a real clear example of how letting infections spread uncontrollably is going to actually perhaps have some pretty significant impacts on us longer term. Obviously, we're not going to manage the pandemic the same way going forward. We need to find a more sustainable way of managing it. We're not going to prevent every infection. We're not going to prevent every case of long COVID, but there's probably more things that we can be doing which are sustainable, which don't disrupt our lives, or we could actually prevent some of this suffering going on. Just want to highlight, the importance of vaccination. And, vaccines, I think, are going to be our #1 way where we're able to sustainably control COVID-19, or at least better control it going forward. There's been lots of talk about, well, if people get infection from COVID-19, that they're again going to be protected. And in Israel, they actually did a study to see what does that actually mean. So, they took a look here, and let's start off looking at this group here who has had infection with COVID-19, not had any doses of vaccine though. And this is their risk of getting and being hospitalized with COVID-19 again. It's about 66%. So they can get reinfected, and when they're reinfected, they have about a 2/3, risk of infection, unfortunately ending up in the hospital again. If we have someone who's infected and has a dose of Pfizer vaccine, all of a sudden their risk is, their protection is better. Sorry, this is not 66% risk of being hospitalized, 60% risk of not being hospitalized. 75% protection from being hospitalized just by getting that one additional dose of vaccine on top of having the COVID infection. So right away we can see that infection is not giving you the best immunity. Getting infected and having that one dose of vaccine actually gives you better protection from being hospitalized. But the best protection actually is you just got vaccinated, you got 3 doses, and you never had infection. And so people who say that, getting infected is the equivalent of getting vaccinated, it is absolutely not. The vaccine gives you much better protection from being hospitalized. So if you look here, 11% of risk of being hospitalized versus 33% risk here, 1/3 the chance that you're going to be hospitalized. And of course, you never had COVID infection. So you never had the risk of being hospitalized the first time around. You never had to risk giving it to more vulnerable people in your life. And you're not going to take on that risk of having those long COVID symptoms going forward. And I think it's significant that people who are infected can get reinfected and may even end up in the hospital again, because we're seeing, as these new variants and subvariants of COVID-19 emerge, we are seeing people getting reinfected, and people who've had even the Omicron virus are being infected with these new subvariants of Omicron. And so we should be absolutely making sure we vaccinate people to protect them, even after they've had COVID-19 infection, because this is not going to be you get infected and you're fine and you don't need to worry about COVID-19 anymore. You can absolutely be reinfected and you can be hospitalized in one of those future infections. So really important we continue to emphasize the message of getting vaccinated. Now, in terms of our vaccine uptake, it's not nearly as high as it has been in the past, but we've been holding steady with about 1,000 doses per day being given, at least during weekdays here. it's significant actually if I look over the last 2 weeks since I did the last media briefing. While most of the doses we've been giving out are third and fourth doses, we actually did about 600 first doses over the last 2 weeks and about 750 second doses over the last 2 weeks. And so while those aren't huge numbers, we're still making incremental progress on those first and second doses, which are of course the most important doses for people to get. So hopefully we're able to continue to make that progress. And if we can continue emphasizing the importance of vaccination, especially to prevent these symptoms of long COVID and make sure people have some protection moving forward, I think that's really important we do. Just touching on our vaccine coverage, and you may have seen this data changed a little bit at the end of last week because we've now got 2021 census data on who our populations are and how large they are at each of these underlying age groups. And so we've been able to update our data a little bit. So in the past, you may remember these numbers were a little close to 100%, and some of these were a little bit lower. With our updated data, it actually shows that maybe some of these groups weren't quite as close to 100% as we thought. But the good news is that especially this 18 to 29 age group and even the 30 to 39 age group has actually ended up being higher than we actually had previously thought that they were. And so that's actually good news that we actually are pretty close to 90% from basically everybody 18 years of age and up. And we're actually not too bad in that 12 to 17-year age, at least with first doses. It's really the 5 to 11 age group where we're unfortunately lagging in vaccine uptake. These are our second doses, and you can see again, pretty close to the first doses. So people who get a second dose pretty much will come, first dose will pretty much come back and get that second dose. We do have more work to do though with the third doses, where this group, the 18 to 69-year age group, we really do need to try and get their third doses up. And then of course, working on the children to get them vaccinated as well. We're doing, vaccine clinics this week at the Canada One Outlet Mall, basically all week. And late in the week, we'll be in Port Colborne and Wainfleet as well to do some pop-up clinics there. And of course, anybody can walk in for any appointment for any dose right now. And again, if people are unsure about being vaccinated and they just want to talk to someone about it, we're more than open for that. People can walk in, come talk to a nurse, understand more about the vaccine and the choices available, and then walk away with no obligation to get the vaccine, but at least have started to have the conversation so they can explore it. So really encourage everybody to make sure they come in, get any missing vaccine doses they haven't had. And if they're not sure yet, please come in and have a talk with us. We'd be more than happy to help you understand the choices so you can hopefully make the right choice for you. Vaccination is, I think, really important as well, because we saw this study come out just a couple of weeks ago here. And this was actually a Canadian study that was looking at the impact of when you have vaccinated and unvaccinated people mixing together. And what it shows is that when unvaccinated and vaccinated people mix together, unvaccinated people are actually protected because now they're around a bunch of people who are vaccinated, who are unlikely to get COVID-19. And so the unvaccinated people are more protected in a society that's open to both vaccinated and unvaccinated people being together. On the flip side, though, people who are vaccinated and protected themselves from COVID-19, because the vaccine isn't 100%, if they're now around unvaccinated people who are much more likely to have virus and perhaps spread it to them, their risk actually increases when they start to be in spaces where there are unvaccinated people. And so the safest place for vaccinated people is to be in groups who are also vaccinated, which really speaks to, I think, the value of something like proof of vaccination requirements, which we had in the past. And we've, of course, stepped away from those. And I do think that is something we should continue to contemplate, especially in future waves, is something we would bring back so that the people who've done their part to get vaccinated and protect the rest of the community can actually enjoy that protection by making sure that they're not being exposed to unvaccinated people who might bring the virus to them. The other big measure that we can be doing right now to make sure we're protected during this wave is, of course, wearing masks. Masks are simple, easy to do. Maybe they're a little bit uncomfortable and a nuisance, but they're really not that big a deal. We can go about our lives and really not have any real impacts on enjoying our lives and enjoying all the new amenities that are once again open. We saw earlier this last week that the Ontario Health Coalition came forward and stated their strong support that people should continue to be wearing masks and that the province should be bringing a mask requirement as well. And I and a few of my colleagues have followed up, really emphasizing that as well, that it's important everybody's wearing masks, and writing to the Chief Medical Officer of Health that we do think that his order on masking right now should be expanded to include some additional public settings so we can make sure people are protected during this time. And this really goes back to that idea that there are unequal impacts from this pandemic, and people who are more vulnerable, who are elder, who are children who can't be vaccinated yet, who have underlying medical conditions, who are racial minorities or poor or indigenous, they're all at greater risk from COVID-19 right now and greater risk of dying from COVID-19, as I've shown you before. And so protecting them by us all wearing masks, I think, is a sensible thing for us to do. Public Health Ontario every week releases a kind of status report, especially on Omicron and what's going on with it. And I just want to highlight that in this latest update they did on Friday, they had this statement here that in the current context of high cases and percent positivity, population level measures can help minimize inequitable impacts of those at the highest risk of severe disease, such as those I've just talked about, those ineligible for vaccination, and those who are going to be impacted when educational settings get disrupted because people have to isolate and the like. And so they're, I think, highlighting the unequal impacts here and the value of population level measures. And they actually go on to just highlight more specifically what they mean, that non-pharmaceutical strategies can be layered into vaccination. These include ventilation, moving outdoors as weather permits, indoor masking in essential settings, and more communication around masking. And so I think they're really highlighting that masking as a population level measure could also really play that important role in reducing those inequitable impacts of the virus on people going forward, at least during these periods, especially when case rates and percent positivity are really high. And so I think there's really clear signs that returning to mandatory masking is the best policy, at least for a short period of time, while we continue to see really high infections. And if that peaking that we're starting to see some evidence of is true, and we do see our infections come down, once they're lower, of course, we can step away from masking for a bit until, unfortunately, that next wave comes. Unfortunately, I do think that there will be future waves. I'm hoping that we'll have a not too bad summer. It could always be disrupted, though, with these new subvariants emerging. And the more we let virus spread, the more opportunity for virus has to mutate and these new subvariants to emerge. If we do have one of those subvariants, we could have a wave earlier. Otherwise, I'm hoping that we can get through the summer. But in the fall, when we move back indoors, everybody goes back to school, I do worry we're once again going to see another wave of COVID-19, and we do need to be prepared for that. I would hope that masking, I would hope that proof of vaccination can be part of our toolbox. But even before we get to that, I really think we need to be making those larger adaptations to our society to make sure that we minimize the risk of even having that wave and making that wave as small as possible. And I've talked about that in past media briefings, and of course I've written about it elsewhere, so I'm not going to go into that. But I really do think that needs to be a priority for us this summer to make sure we protect ourselves from the virus longer term. Last thing I just want to talk about is stepping maybe a little away from the COVID-19 story. Is I know everybody is well aware we're in the middle of a provincial election, and our Association of Local Public Health Agencies has put out this quick primer on election candidates, and I just want to quickly highlight it. We go into all of the work we in local public health have done around the pandemic, all the different work we've done. And our achievement is, of course, over 7 million people in Ontario have been vaccinated with 3 doses, and many more millions actually with 2 doses. We've followed up with more than 1 million people infected with COVID-19, doing contact tracing for them, and of course, all the different things we've done in public health. And we really want the public to recognize that this has come at a significant effort on our part. On average, local public health agencies diverted 78% of our resources to managing the pandemic, which really meant we weren't able to deal with many of the other health issues that we might work on. We're seeing clear increases in things like substance use and mental health, and widening of those inequities in our society in terms of health impacts. And what we're really calling for is, we highlight here, is that there be sufficient resources in public health so we can deal with these fallouts, and the stability in what our structure is going to be going forward, so we can be focused on serving the public and not focused on perhaps reorganizations of the public health sector going forward. And public health is about 2% of the Ministry of Health's total budget. We're only a small portion of that budget. So even a tiny, fraction of a percent increase in funding for the Ministry of Health going to public health would be a really significant impact on our ability to serve the population, to deal with these unequal and longer term health impacts that we're seeing, and make sure we're also better protected for the pandemic going forward. And so we hope people will pay attention to that, and we go through this election, candidates will pay attention to that, and hopefully we will be able to see a strong public health response coming out of this pandemic. And so with that, I'll stop and turn it over to Courtney to coordinate the questions.
Okay, thank you, Dr. Hergy. So first up with questions, we have Victoria, and you should be able to unmute now.
Hi, Dr. Hergy. Thank you for sharing. I had a question mostly about this concern, or not concern, but concern from you on the attitude from some of the people of the inevitability of getting COVID. And I know you mentioned like long COVID and the possibility of having better vaccines in the future and kind of getting obviously the virus once and not doing it, and you can still get it again. I just wanted to hear from you the concerns from those people on that inevitability. Sorry, that was a hard word.
Yeah, so, I think the inevitability argument is a bit of a defeatist argument. I don't think that we're going to prevent 100% of COVID infections, but that doesn't mean we shouldn't try to prevent those that we can, especially in ways that are sustainable. I completely agree. We don't want to be going back to shutting down society and going to lockdowns or having capacity limits. We need to find a sustainable way of doing that going forward. We've had lots of infections in our past, which were infections that everybody suffered from. Malaria used to be endemic in this part of Ontario. Nobody gets malaria anymore. People used to get gastrointestinal infections all the time. It's just one of the things that happened. That doesn't happen anymore. We've prevented those from happening. I think we should be thinking about this infection the same way we've thought about other infections, that there are ways for us to actually sustainably prevent it and make our society healthier overall. Because of course, everybody is going to live their best life if they can actually be healthy to enjoy that life, and they're not suffering from having a family member hospitalized or being sick themselves or being at risk of developing long COVID and having those longer term disabilities. And I think there are truly things that we can do that we have not yet done. We could do a massive project in our society to upgrade the ventilation and filtration systems to clean our air. That could reduce our risk of getting COVID-19. I've talked about we could rearrange our holiday calendars to reduce big spikes of infections after holidays. I've reminded us about the unequal impacts of the virus, and if we can address some of those inequalities, that can actually make more people resistant to having some of the most severe outcomes from this virus. I do think there's lots more we can do, and we could try and make our society a healthier place overall. And these are things that we haven't done yet. And so I would think it behooves us to make those attempts and see how far we can get into making society healthier, rather than throwing up our hands and saying, well, we're all going to get COVID and we'll just have to live with longer term, more people being hospitalized. We're going to have to pump more money to our healthcare systems to deal with that. We'll have to just accept more people are going to be disabled because they're going to have the symptoms of long COVID over the long term. I just don't think that is an acceptable way for us to be approaching society. We should be trying to make our society as healthy as we reasonably can.
And a follow-up?
Oh yeah, my follow-up was just on the masks. I know earlier on you had mentioned the difficulty with having something different come from the region and something different come from the province. Are we getting to a point where it's either going to be maybe too late to install those mask mandates, or is it something that we're still considering for at least Niagara?
It's still something we're considering. There's definitely hopeful signs that maybe infections are coming down, but they're coming down from being very high, so they're still very high right now. And there's no guarantee that this trend will continue to come downwards. I think the province and the science table were in mid-April speaking very hopefully they thought we'd peaked, and of course we turned out not to have peaked. So this could absolutely go in another direction. So I still think it makes sense for us to have masking right now. If we are heading downwards, all it will do is get it, infections down more quickly, so we can get back to not having to worry as much about COVID-19, and in the process protecting a whole bunch of people. And if we unfortunately aren't turning down as quickly as we want to, the masks are going to help us bring infections down more quickly. I still think it makes far more sense for this to be done provincially rather than locally, but I'm not ruling out the option of doing it locally.
Okay, thank you. Up next, we have Paul, and you should be able to unmute.
Oh, can you hear me okay?
I can.
Thanks, Courtney. Dr. Hergy, so you mentioned about this belief among many people that natural protection by becoming infected with COVID is the best defense. Your stats show otherwise. But is that belief, do you believe, a barrier to people getting vaccinated?
I think it is. There's certainly a group of people who've never gotten any doses of vaccine because I think they're holding on to that belief. I do think, though, the bigger part that more concerns me is the people who have not yet got their third dose. And are some of those people who got their 2 doses, unfortunately, when the Omicron variant came along, 2 doses wasn't enough and they still got infected with COVID-19. And they're feeling, well, I already got it now, no need for me to go out and get the vaccine. And my argument for them is that absolutely still need to get the vaccine. We're seeing people, as I showed, getting reinfected. We're having these new subvariants. Obviously, the recommendation is you don't get another vaccine for 3 months, but after those 3 months, go out and get that third shot and make sure you have the best possible protection going forward from any future variants we get, and to make sure you don't get any kind of reinfection from this version of the virus either.
And a follow-up?
Right, and you've stressed the importance of masking, but with each passing week without having a mandate provincially or even locally, does it become more and more difficult to expect people to adhere to that? If at one point the province or locally, new rules are brought in, is it hurting, making it more difficult by having a period where we don't have masks?
I'm not as convinced of that. Back in 2020, when we first brought in mask requirements, people very quickly took them up, and they had no history of wearing masks in the past. It wasn't part of our culture the way it might have been in East Asia, but people very willingly took it on. I think what's becoming harder and harder over the weeks that we've had since the mask mandate has dropped is the effectiveness of convincing people to voluntarily wear masks. Anecdotally, I hear from everybody, and I observe this myself, fewer and fewer people are wearing masks out in the community. I think as we get farther away from that requirement, it becomes less of something it feels like it is a social norm for us to do. And I think a mask requirement would reintroduce that social norm and would send the signal from the government that wearing masks is again something important that we want everybody to do. And I think people would follow through on that. We've seen through polling very consistently that the public is pretty okay with wearing masks. They're not drastically opposed to it. There's a small number who are really opposed to it, who've always been opposed to it, but most people are okay with wearing it. It's obviously no one's preference to wearing a mask, or at least very few people's preference to wear a mask, but most people are very happy to wear a mask. They think it's going to do a good thing. And I think having the province come out and require wearing masks again, I think will send that signal that it's something important. And I think people will follow through on that based on what we see in the polling data.
Okay, thank you. Up next, we have Ludwig, and you should be able to unmute now.
Thank you for that. Hello, everyone. Hello, Dr. Hergy. So we're approaching summer now, like you said, and you're hopeful that there's not going to be another wave of this stuff. What do you think is going to be the main determinator whether how bad it's going to get?
Biggest determinant of how bad things get this summer, I think, will be if we see new variants or subvariants emerge that are more resistant to the vaccine or more able to reinfect us. We already see some of those subvariants having emerged, which is going to make it more difficult than it would be otherwise. But if we see further mutation of this virus, we see something, another, game changer like Omicron, that could mean we have a pretty big wave over the summer.
And a follow-up?
Right. Thanks for that. So we see most people seem to be not wearing masks in public settings right now, at least the ones that are not stipulated, like grocery stores, etc. And things are heating up on Clifton Hill and Niagara Falls, and there's a lot of movement. So how do you plan to in case of a new subvariant, for example, how optimistic are you that the messaging that we've heard now for about 2+ years about the importance of masks and washing hands, etc., is gonna be received in case of, say, a new subvariant emerging and numbers rapidly going up?
I'm quite optimistic that Canadians and Niagarans want to do the right thing, and they want to protect the people around them. And they're really looking to their leaders for the guidance of what to do. And I think, of course, the province is always going to have a much bigger voice than we are going to have here locally. And I think they're following the province's lead. The province has said that, you don't need to wear masks. It's your personal choice whether or not you wear masks. Getting vaccinated, not really important. We're not going to require it in most places anymore. And I think people have basically taken that signal and they're following through on that because that's what their leaders have told them. So they're not really in any urgency to go out and get additional vaccine doses, or they think it's not even really important for them to do. They're not wearing masks because they've been told it's really a personal choice. If you want to, it's not that important. And that's what we've seen. I think if we saw the province come back out, say these are really important and start to require proof of vaccination or require masks be worn in these settings, I think the public would respond by saying, this is the thing that we need to do to protect each other in our community. So we're going to go back to doing that. I think where the public would be probably harder to bring along is if we were going to close down businesses or public amenities again, or introduce capacity limits. I do note the public did go along with those in the past because I think, again, they recognize the importance of those at those times. I think they would be a harder sell to do some of that, but I think they could do it. But I don't think we're going to need that. I think we have vaccination, we have masking, we have new treatments. There are tools we have where we could, mitigate any future wave. And I think we just need the provincial leadership and their strong statement and requirement of it, and the people will follow through on that.
Thank you. Up next, we have Penny, and you should be able to unmute.
Hi, thank you. Dr. Hergy, I feel like I ask you the same question every time we have this press conference. Today, again, you talked about you would prefer to see a provincial mandate to reinstitute mask wearing, but you will still consider doing it yourself locally. What would make you take that step? Are you thinking of, you talked a lot about a next wave, or is that what you're waiting for? Or are you still thinking of doing it now? Or could you be a little more specific about that?
Yeah, it's a difficult dynamic, and I've explained in the past where if you're trying to convince the province to do it, if you start to act locally, you take the pressure off of them doing it. And of course, a local only measure is going to be far less impactful than a provincial one. Niagara has so much travel in and out of the region. If we have a mask requirement here and not anywhere surrounding, that's going to really weaken the impact of the mandate we have here. I also think that the people are going to really take a lot more credence to what the province is saying. I think they have a lot more clout and credibility. Just generally, provincial government has more than the local government on that. And so there's going to be much more adherence if the province is doing it. And there's a consistent rule across the province rather than a patchwork where it's going to start looking like, people can pick whichever rule they want, which is a little bit of what we have right now, where the provinces, if we did it required here and the province saying it's not a requirement, I'm not sure that gives a clear message to the public. And so there's not necessarily going to be that same buy-in. So the time for now, I would really want to try and keep the focus on the province to try and convince them that they should take this action. I think in this wave, it's important. I think it may be even more important in a future wave that ends up being worse than this. That being said, if we did see a level of hospitalizations that are continuing to increase to a point where our hospitals are really stretched, that would be perhaps a reason where I'd want to take, the action of doing a local requirement here, recognizing it wouldn't be as impactful as it might be otherwise. If we start to see a lot more people dying of COVID-19 or seeing some of those more severe impacts in much larger numbers, that would be a motivator to maybe go ahead with a local order and accept that where it's not going to be as effective as if it could be with the provincial one. Right now, I think we're still focused on trying to push the province on this. We've just sent a letter to the Chief Medical Officer of Health. We had the Ontario Health Coalition come out with their statement last week. I'm hoping we can start to build a little bit more discussion and really make that case more strongly to the province right now.
And a follow-up?
Yes, you just talked about the pressure that is now being put on this provincial government, and also that there is a provincial election coming up. Are you hoping that that pressure between now and then can accomplish something quickly, or are you thinking more a little long-term after the election?
Yeah, so I'm not really thinking in terms of timelines of the election. I think the election is sort of irrelevant to this. The timeline I'm worried about is, of course, us being in a wave with high amounts of COVID-19 right now, lots of people hospitalized, more people currently dying from COVID-19 than they were a few weeks ago. I think there is reason for that we would like to see a mask requirement come in place earlier. We very consciously have focused on the Chief Medical Officer of Health as I think the best place to try and get that happening, because I think the political side of government is very focused on the election and they're probably a little disengaged from these conversations right now. The Chief Medical Officer of Health also showed some real leadership a couple of weeks ago when he brought in his province-wide Section 22 order to make sure that masking remained in transit, in healthcare and congregate settings. And so he's opened the door to actually taking that kind of action. And I think our focus really wants to be to try and convince him to broaden that action during the rest of this wave, and then make sure he's able to act in perhaps a future wave if we don't see the political side of government acting again.
Thank you.
Thank you. We've now gone through everyone who had a first question. So we'll open it up to second questions. If anyone does have another question that they'd like to ask, if you can let me know in the chat, and I will let you unmute. Okay, Victoria, and you can unmute.
Hi there, just want a quick follow-up on, have you heard at all any response from Dr. Moore so far from that letter you sent last week?
Yeah, we did get a letter late Friday from Dr. Moore where he acknowledged our concerns, explained what he had done in terms of his thinking around which settings he included in the order, and promised to continue to monitor the trends going forward. But doesn't sound like he's going to act on that yet, which I think nobody expects that you send one letter to the Chief Medical Officer of Health and he's going to suddenly change his mind. The other significant thing he mentioned in his letter was a really strong statement that he strongly recommends everybody is continue to wear a well-fitting mask in indoor public settings, especially where they can't keep physical distance. And I thought that was an important statement, that the Chief Medical Officer of Health definitely agrees that people should be wearing masks, even though if he's not necessarily going to require it at this moment in time. So that's the response we received right now. I think we're going to continue to message the importance to him and try to convince him to move on the requirement.
Okay, thank you.
Thank you. Okay, not seeing anybody else in the chat, we'll end things there. Thank you everyone again for attending, and we'll see you again next time.